Dubai Eye 103.8.
Now, here on the agenda, we are keeping up to date with all the developments in the COVID-19 story. And one of the positive stories coming out of the UAE centres around testing. Earlier this week, the head of the World Health Organization, Dr. Tedros Ghebreyesus, said governments were not doing enough to combat the pandemic and urged them to step up their testing programs.
So the test that
we have a simple message for all countries: test, test, test.
Pretty defined moment there. And it's fair to say that the UAE has been getting that right. In fact, the World Health Organization has directly praised the UAE for its record on testing. According to the Ministry of Health and Prevention, the country has the highest testing coverage in the world. As of yesterday, the UAE had carried out more than 127,000 tests for COVID-19. We wanted to find out a bit more about the way this sort of testing program works. So we got in touch with Dr. Wael Elamin, who is a virologist and epidemiologist at King's College Hospital, Dubai. I started by asking him, how does the test for COVID-19 work?
So the test that we are currently using, and that's the only approved test at the moment that the whole world is using, is called the polymerase chain reaction. Sounds like a very big name. So basically all it is we look for the genetic code itself that makes up the virus. It's the miniature version of what people would hear a lot about the genome sequencing. But this is targeted specifically at the virus. As you may well know, each organism has a certain genetic code. So what we do is we target specific sequences at 3 different positions for this virus. So it's called the E gene, the N gene, and the ARDP. So that's what they look for, 3 different genes of the virus that are targeted. And that's the only test. There are a lot of scams at the moment online and non-official healthcare organizations offering blood tests. There aren't any blood tests at the moment that are approved. It's only for using swabs that are taken from the nose and from the mouth. And then they get sent to a very specific lab that can handle these types of viruses.
So I've heard lots of news about people struggling to get hold of these tests in other countries like the US and the UK. But here in the UAE, we've already tested 127,000 people. How come we've got so many tests here?
So the UAE is a hub. And being a hub meant that we were expecting cases coming in early. So as soon as the cases were coming out in China and the test came out in mid-December, the authorities procured sufficient amounts to commence the testing. So the plan and the preparation for outbreaks was actually preparedness plans were put in place because of Expo 2020. So with that, they always had a preemptive plan of an outbreak. It just happened to come 6 months earlier.
That's extraordinary to hear that the government was so prepared, especially compared to the rest of the world. That's very good news for everyone living here.
Correct. It's just with large congregations, so certain countries are always or they go into preparations. London 2012, we had to do the same with the Olympics. So countries, they get into preparedness because you have an influx of people coming into the country from different parts of the world, and each with their own specific sort of illnesses that could come in. So you have to be ready to be able to identify them. You should have systems in place. The same with the Olympics in Tokyo. They'll probably be going through their preparedness plans. In Saudi Arabia, because they have a large influx every year for Hajj, they're always on standby. And as such, and luckily because of the Expo 2020, the UAE had instigated a plan anyway for the Expo, and they just had to activate it.
Can I get hold of a test myself, or do I have to go through a doctor's surgery or hospital?
I think the first question is why. Why would you think you need a test, and how would it affect and change your plans in life? Or your day-to-day activity? Why would you want to have one? Is it to reassure you that you don't have it? But if you don't have it now, you might get it on the way to the hospital or on the way back from the hospital. So at the instant that you have the test that may be negative, doesn't necessarily mean it will remain negative. And hence, there are guidelines to who we should test. But the real question is the why. Is it for your own sake, or is it to prevent the others? To prevent the others, if you're asymptomatic, very simple, self-isolate. If you don't have any symptoms, if you don't come in contact with anyone, you're not going to harm anyone. And if you're asymptomatic in the first instance, the test would not add any benefit to you or to your health, especially that we don't have any specific treatment for
So I know that this question gets asked a lot, but I think it bears repeating. When should I get tested? At what stage should I go to a doctor or hospital and tell them that I think I need to be tested, that I think I might have COVID-19?
If you have symptoms, and the symptoms are cough, shortness of breath, difficulty in breathing, fever, and fever is the commonest presentation anyway, diarrhea, and having either confirmed contact with someone who has tested positive. So you yourself have been sitting in a room within 2 meters with someone who is positive, then you should report it. Or if you've returned from a country with an ongoing outbreak as defined by the DHA. The reason is, although we have sufficient reagents for testing, the amount is finite at the end of the day. And we have to prioritize as to what and where and how authorities think we will be able to protect everyone. As such, if you do not fulfill these criteria, and if you're feeling well, please help us by not overwhelming the healthcare organizations and hospitals. Again, thinking of it, if you're well, you go to an ED, you might be sitting next to someone who actually isn't well who has it.
Feeling contentious? Want to add some context? Have your say and join the conversation on The Agenda.
On Dubai Eye 103.8.
So we are continuing our interview on COVID-19 with Dr. Wael Elamin, who is a consultant in medical microbiology and infection control at King's College Hospital, London, here in Dubai. We talked in some detail about testing, as you've just heard, but I also wanted to talk to him about curing COVID-19. I asked him, can you vaccinate against viruses?
So yes, certain bacteria and viruses, what you can do is if you give people an attenuated or less active form of these viruses or bacteria, their body responds to them and then their body recognizes the real thing when it meets it and just attacks it and settles it.
Are scientists working on one now for the COVID-19 virus?
Absolutely. From day one, the virus was identified. They started immediately to try and identify a suitable vaccine. They're not easy to produce. It needs to go through a rigorous process to ensure that both the vaccine is active and safe to use, as there have been previous vaccines developed for some other infections, such as HIV, which were unsuccessful. As such, you have to go through a very rigorous process where scientists first identify a suitable agent, then they test it in animals initially, and then they test it on volunteers, and then you test it on more volunteers, and then they circulate it to the general population.
So realistically, how long are we looking at before a vaccine will be, I suppose, ready? And then the second question would be readily available.
Most optimists would say not less than a year.
Okay, that sounds positive.
Yes, I mean, on average cycle of developing a vaccine takes between 10 to 15 years in most circumstances. Having something out in a year would be an achievement and a record in itself.
I mean, once a vaccine is introduced into the system, into the population, does that basically bring an end to the disease? Is the vaccine the solution?
It's a very difficult question to answer because as much as we would love, it might end up the infection with this current strain with coronavirus, but then again, the virus itself might mutate and sort of become irresponsive to the effect of the vaccine. So I think it's too early for us to say anything. Until we know, we don't know.
That is Dr. Wael Elamin, who was very kindly gave us an interview yesterday about both testing and vaccinations. He is a consultant in medical microbiology and infection control at King's College Hospital, London, here in Dubai.
This is Dubai Eye 103.8.